Inflammation is a complex biological response designed to protect the body from harm. It's a double-edged sword, essential for healing but potentially harmful if left unchecked. The inflammatory process. 1. Injury or infection. When the body detects damage or foreign invaders like bacteria or viruses, it triggers an alarm. 1. Vascular response. Blood vessels dilate, increasing blood flow to the affected area. 1. This brings immune cells and nutrients to the site of injury. 1. Cellular response. White blood cells, such as neutrophils and macrophages, migrate to the injured area. 1. They engulf and destroy pathogens, clear cellular debris, and release inflammatory mediators. 1. Healing and resolution. Once the threat is neutralized, the body initiates the healing process. 1. New tissues are formed to repair the damage, and the inflammatory response subsides. The role of inflammatory mediators. 1. Cytokines. These signaling molecules coordinate the inflammatory response, attracting immune cells and promoting tissue repair. 1. Chemokines. These molecules guide immune cells to the site of injury, acting like a homing beacon. 1. Prostaglandins and leukotrienes. These lipid mediators contribute to inflammation by causing vasodilation, increasing vascular permeability, and stimulating pain receptors. Types of inflammation. 1. Acute inflammation, a short-term response to a specific injury or infection. 1. It's characterized by redness, swelling, heat, pain, and loss of function. 1. Chronic inflammation, a long-term, low-grade inflammatory response that can contribute to various diseases, including heart disease, arthritis, and cancer. 1. It often occurs when the body's immune system becomes dysregulated. The importance of balanced inflammation. A well-regulated inflammatory response is crucial for health. However, chronic inflammation can lead to serious health problems. Factors such as poor diet, lack of exercise, stress, and exposure to toxins can contribute to chronic inflammation. Managing inflammation. To manage inflammation, it's important to 1. Adopt a healthy lifestyle, eat a balanced diet, exercise regularly, and manage stress. 2. Get enough sleep. Adequate sleep is essential for immune function. 1. Consider anti-inflammatory medications. Over-the-counter pain relievers like ibuprofen and acetaminophen can help reduce inflammation. 1. Seek medical advice. If you have persistent inflammation or a chronic inflammatory condition, consult a healthcare professional. By understanding the mechanisms of inflammation and adopting healthy lifestyle habits, we can help our bodies maintain a balanced inflammatory response and promote overall well-being. Sources and related content.